So influenza continues to be a big concern for us. This year has been kind of an unusual year for influenza. Typically we see a predominant circulating strain each season, whether that's a H1N1 strain or an H3N2 strain. Last year, the 2017-2018 flu season was an H3N2 year, and those tend to be kind of more severe years, hence the large number of hospitalizations and deaths that we saw, over 180 pediatric deaths, which was a very large number. This year has been an unusual year for influenza because we're now seeing a second wave of infections caused by the H3N2 virus. Thus far, this has been mostly in the southern part of the country, and so we're waiting to see what will happen in more northern areas. But as we've seen H1N1 kind of peak and start to go away in some areas of the country, we've seen a second wave of H3N2 infections. This is unusual. Usually it's one or the other each year, and so we're all kind of watching and waiting to see what happens and how this affects the numbers this year. Influenza can cause numerous types of complications. One complication is it can lead to development of a bacterial superinfection. So after you have the influenza virus, your defenses against bacteria are not as great, and so you can develop things like ear infection, sinus infection, or bacterial pneumonia. Influenza itself can cause pneumonia, and if that becomes severe, then people may wind up in the hospital needing to get oxygen, fluids, and things like that. Influenza can also lead to a serious secondary infection called sepsis, which is a very serious life-threatening infection that people need to be in the hospital for and need to be managed, usually in an intensive care unit type setting.